Hello, welcome to McDonough District Hospital, Department of Mammography. I'm Lynn Durso, and I'm one of the 3 licensed and registered technologists here on staff at MDH. I've been doing mammography for over 29 years, and my co-workers, Lisa Pennington and Teresa Anderson, have been here even several years longer. So the 3 of us do provide many years of experience to the department. So why should you have your mammogram every year? Early detection of breast cancer. The sooner we detect your problem, the better your prognosis will be, not only to save your breast, but can save your life. So at what age should you start having your mammogram? We recommend that you have a baseline screening at age 40 and annual exams thereafter. However, if you're someone that has had a close family member diagnosed with breast cancer before age 40, you would need to start your screenings even earlier.
I'm Stephanie. I work here at McDonough District Hospital. I've been here almost 4 years. I'm a health educator in outreach services. And I had to have a diagnostic mammogram done at age 29. I actually went in for my yearly women's health checkup through our women's center here on campus. And they wound up finding a lump in my right breast that they wanted to check out.
If you are someone that your physician has found something abnormal on your breast exam, or you're having breast symptoms, a lump, nipple discharge, breast pain, you would be scheduled for what we call a diagnostic mammogram. With the diagnostic, not only do we do some additional special images, but you'll likely be scheduled for ultrasound. Ultrasound is another modality that's often used in breast imaging. Even though it's not recommended to use ultrasound as a screening tool alone, if used in conjunction with a mammogram, it's very helpful to help determine if something that you're feeling or we see on your mammogram is a solid mass or just a simple fluid-filled cyst. So when you first arrive at MDH, you're going to start in the registration department. They're going to give you some paperwork to fill out, and the breast history questionnaire is a very important part of your exam. We need to know, did your doctor feel something abnormal? Are you having any breast symptoms? Have you had breast cancer, breast surgery? Do you have a family history of breast cancer? Has your most recent exam been at a different facility? If so, we will want to get those for comparison.
The radiology staff was great as they took me back into the room. They explained that they were going to give me a gown and that I only needed to take from waist up off. They did call the day before to let me know not to wear deodorant or powders or anything like that so it wouldn't show up as abnormal on my results. And as soon as they were ready with the machine, they brought me in and they showed me and talked me through the whole machine before they started the process and made sure that I was comfortable through the whole process.
Then our machine is adjustable, so we can adjust it for height if you're taller or if you're shorter. And then when I'm actually doing the compression, this is the paddle. This is what we call the platform or the plate where your breast will be. I will help guide your breast on here. And then we have a foot switch, an automatic foot switch that we can use to also adjust this. But once I get to the breast, I can manually do it. That way you're in control of how much compression that you are able to tolerate. If it gets too uncomfortable, let us know, because I would rather reduce the compression slightly and have you get your exam finished and keep coming back than to make it so unbearable for you that you never want to come back, because that kind of defeats the purpose of early detection. So we're going to do images from top to bottom, and then this machine turns, and this is how we accomplish the more of the side view. Your arm will come across here, your breast will be on here. This is how we see up under your armpit where you have lymph nodes and things, as well as we try to see as much of the muscle behind your breast so that we know we have all your breast on the exam.
All right.
And I want to tell you that since this is your initial exam, that if the doctors would like something more at a later date, either additional pictures or ultrasound, don't be alarmed, because we have nothing to compare on you. So when you come back in the future years, we'll have today's and thereafter to compare. So I always like to tell you that before I start, because if I tell you after I'm done, then you're going to think, she saw something and now she knows I'm going to have to come back. So I just want you to be aware and not to be upset if they do call you back for additional images.
I'm glad that I chose to come to MDH and do the 3D mammography, and that thankfully nothing came back positive and that I am healthy. I do plan to continue to do this on a yearly basis, just since that has been found that I'm going to start earlier than 40 to continue to keep coming here. If you're not 40 yet, but you have a family history, I definitely recommend talking with either your primary care provider or your women's health provider about when you should start, as well as making sure you're getting in yearly for your exams, and having them help teach you how to do a self breast exam.
So if you want to schedule your 3D mammogram, call us at 309-836-1550. Thank you for choosing McDonough District Hospital.